I'm Dr. Mandy Kirk from Move to Success Physical Therapy. Today we're going to be discussing postural exercises. So I think that this is a common problem for a lot of different people, and what I normally see with people who have poor posture, especially people who do desk jobs, is that they have, oh, my son is here. They have tight neck, like back of their neck area, and tight pecs, so chest, and then they have weak upper back and weak front of their neck. So this can cause a lot of pain, especially when you're sitting hunched forward at a desk all day. So I wanted to have some of those exercises demonstrated that can help with this postural pain. So the first exercise that's being demonstrated over here is thoracic extension over a foam roller. So this one is great because it puts you in a reverse position of the position that you're usually in when you're hunched over like this at a desk. So normally the thoracic spine is rolled into what's called kyphosis, which is it's rolled forward, and this puts you into lordosis, which is extension. So putting the foam roller just below your shoulder blades and leaning back over and doing almost like a reverse crunch over top. So quantity for this is nice and slow progressions, and perform somewhere between 10 and 20 times. I usually tell people 20, but if this is your first time doing the exercise, break yourself into it slowly.
All right, what's next?
Our next exercise is kind of a modified fish pose, if you've ever done yoga before. It's putting you into a similar position of that thoracic lordosis or thoracic extension. So leaning back onto the elbows and putting the back and the neck back and leaning into it. Hold for about 5 seconds and then repeat 20 times. All right, and moving on to the next exercise. So the next one is working on strengthening the cervical, the front of the neck muscles. So what you can see that he's doing is he's bringing his chin as close to his chest as possible. So doing a tilt in that cervical region and the neck region, and specifically trying to get almost like a double chin and trying to move only those top vertebrae. So this is important because we are, again, putting him into the reverse of the position that he's usually in, which is too much cervical lordosis, so bringing that neck too far forward, so we want to do the opposite. So this one's really good for strengthening the front of the neck and stretching out the back of the neck. This is a hold for 5 seconds and repeat 20 times exercise. Nice and slow, focusing on the movement.
Pretty sore.
Yeah, it's amazing how much you can feel these exercises very quickly. Okay.
Next one, stretching.
Pec stretch is next. So,
I guess I need this.
yep, you can do this with the foam roller again. So you can get a foam roller fairly affordably. Putting the foam roller along your back vertical, and then opening up your chest. So putting your arms in a position where they're nice and wide to stretch out the pecs. So this is a really good pec stretch. Hold for about 20 seconds in this position, and then release. So go back into whatever normal position is for you, or that reverse, and repeat 5 times.
Use weight.
You can use weight in your hands to give you a little bit of extra. And you can kind of find a good position for you. So if this feels better than this, which feels better than this, that's totally fine. You can even do elbow extension. And you're going to feel that right here in the front of your chest.
I think the next one is, I already do that chin thing, where I push my head into the.
So the next one is deep cervical flexor strengthening. So your deep cervical flexors are right here on the front of your neck, and you don't use them very often. You use the superficial shallow ones to nod yes and no, but you don't really use the deep ones a lot. So the deep ones are the ones that actually put you into that double chin position, bringing your head back like this. So I tell patients to push their head, just the back of their head, straight down into the table and try to create that double chin position. And this is a hold for 5 seconds and then release 20 times. If you really want to take it up a notch, you can even hold it for 10 seconds. But I wouldn't recommend doing more than 10 of those with the hold for 10 seconds. And when you release that, try to give yourself as long of a break as what you were doing the exercise for. So if you were holding for 5 seconds, release for 5 seconds. If you were holding for 10, release for 10. Okay. And then finally, you'll see he's heading over to where we do our rows with the TheraBand. So these are stretchy bands. The point of this exercise is to strengthen this kind of upper back region here. This is upper thoracic spine. So he's going to be pulling that band and trying to pinch these shoulder blades together like he has a pencil between his shoulder blades that he's trying to squeeze. So I usually recommend that people do 20 of these. There's 3 different positions that you can do for rows. You can do rows that are higher than your shoulder, at shoulder, and then lower than shoulder. So that's hitting the 3 different parts of the trapezius muscle, which is a really big muscle here that people tend to have issues with when they have bad posture. So I tell people to try to do 20 at each level. So 20 high, 20 in the middle, and then 20 straight up coming from below. So these exercises are going to fatigue you. They are a lot, but they're going to be great long term. You're going to feel changes. And I believe that that's all of the exercises that we have.
Yep.
So feel free to like me on Facebook and like my YouTube channel. You can follow me and ask any questions that you have. Thank you so much.